No matter who we are, if we live long enough, we will eventually need assistance. The body just doesn't last forever. The average cost of home care in the US is $62,000 per year. And this is out of pocket and simply unaffordable for most. Keep in mind that 66% of Americans live paycheck to paycheck. In our society, we don't openly talk about aging and how to approach the latter stages of life, financially, socially, mentally. In fact, the opposite is true. Ours is a society that glamorizes youth, and our elders are often neglected, and we're here to change that. Half of Americans have no retirement savings, and as we get older, it's common to have healthcare expenses. Things don't always go as planned. Let's say we suffer from a stroke and can no longer walk properly, or a loved one gets a diagnosis of cancer, Alzheimer's disease, or Parkinson's, and all of a sudden they need someone to care for them. Most of us rely on our partners, or older adults may rely on their children to care for them as they get older. The unspoken expectation. But sometimes there's just too much for one person to handle. Maybe they have their own issues to deal with and care is overwhelming. Family members often have to juggle their own lives, a full-time job, and children. And in some cases, family members just live too far away. And in other cases, professional help is needed. Maybe medical care is required. But care of this kind can be expensive. Imagine if all of a sudden you had a bill of $5,000 per month in addition to all your other bills. This is the average cost of home care in the US. Most people are just not in a position to absorb that. And insurance typically does not cover long-term care. And as a result, many older adults and their families are stuck and they don't know what to do. Instead of just complaining about this issue, we can try to do something about it. And that's exactly what my team and I are working to do at Olera. We're working on two strategies to help fixing aging in America. The first is through community. We created a common space where older adults and those who care for them can connect to others going through a similar journey. Not only can users get answers to their questions, but they can share their personal stories and connect to others who might be going through something similar. In addition, we plan to have in-person events like community walks and group trips that really separate this from other online forums that you might see. This is just the beginning. We really want to make this the space where people can have meaningful connections and get the support they need and really shine the light on this neglected space. This is just the beginning. We're really excited for that. The second way we plan to fix aging in America is by changing the way families find and pay for care. With the support from the National Institute on Aging, we've actually been working on this for the past 2 years, and we've developed a website where people can find the best local care based on their needs. But we're excited to share that we'll be making some key improvements to the website using artificial intelligence to help families better pay for care and find care that they can afford. We're really excited about this, and we'll be rolling these developments out over the next year or two. As an immigrant from Nigeria, I've seen people live in poor conditions. I've seen people really suffer, and this has really had an impact on me, especially suffering with healthcare issues that can be prevented. So I've dedicated my life to developing novel technologies that can prevent, or at least reduce or postpone, human suffering in the healthcare space. I was always good at math and science, so applying these skills and this knowledge into developing cool technologies that can improve human health, that really seemed appealing to me. This is what motivated me to study biomedical engineering. So I got my bachelor's and master's degree in, and I was actually halfway through my PhD when I took some time off to start Olera. And this is when I met my co-founder, Logan, who had a background in medicine and in business. And he also had deep ties to this topic of aging care, Alzheimer's disease. So we really clicked. And together we had this goal of really redefining how we age in America. The environment at Texas A&M University was extremely supportive. People really resonated with the problem we were working on, and they wanted to see us succeed to build something that could really help others. I mean, it's not a huge surprise. Almost everyone has at least one family member who has some type of health issue that requires care. So now our goal is to radically simplify how people find and pay for care. We also want to foster this community where people can connect to others going through the same journey so that they're not alone through what could be an otherwise difficult time. The challenge of improving how people age in America is too big for just one company to solve. We need your help. Whether you're a caregiver navigating the complex landscape that is senior care, or a professional working in the senior care industry with insights to possibly share, or if you're just someone who's passionate about this problem and you want to work on something meaningful and challenging, we'd love to hear from you and possibly have you on our team. Please reach out. Reach out to me at tj@olera.care. Thank you.